No matter where you are on your feeding journey, combining breastfeeding and pumping can be a great way to give yourself some flexibility while maintaining your milk supply. It can be a game changer in so many situations, whether you're newly postpartum and sharing nighttime feeds with a partner, returning to work, or planning a trip away from your baby, but it can also come with a few challenges. In this video, we'll walk you through some of the mistakes moms make when combining nursing and pumping with the help of our friend Britney, a nurse, doula, author, and international Board Certified Lactation Consultant with our partners at SimplyFed. Let's get into it. With a few exceptions, such as having a baby in the NICU, lactation consultants recommend that you wait until you've established breastfeeding before introducing a pump. This is usually around the 6-week mark, when you and your baby have gotten into a routine and your supply has settled. Pumping too early can pose a challenge to your body's natural supply and demand response and put you at greater risk for developing undersupply or oversupply by pumping too infrequently or too often. On the other hand, waiting until you've gotten into a groove at the breast will make you a more confident pumper. You'll know how often your baby wants to eat and for how long, and have greater peace of mind that they're getting what they need from the bottle. If you'll be pumping frequently, getting on a schedule and sticking to it will help maintain your supply and make your days feel manageable. This is important since you won't be nursing on demand, and feeding frequency is one of the most important factors in supply maintenance. Your pumping schedule will depend on a few different factors, but you should aim to pump as frequently as your baby has been feeding, or every 2 to 3 hours for about 15 to 20 minutes. This will help mimic your baby's feeding routine and tell your body to continue producing milk. Consistency is key. If you miss a scheduled pump session, pump as soon as you're able to, and then pump again at your next scheduled session. It's okay if they're close together. Even though you're pumping on a schedule, you can still feed on demand, offering a bottle whenever baby shows hunger cues. Many moms don't realize that their pump might not fit right out of the box, but once you add pumping to the mix, finding your flange fit is critical. This ensures that you'll get optimal milk output and keep your supply up. To find your fit, you'll want to measure the width of your nipples and then calculate your flange size based on the instructions specific to your pump. You may need to do this more than once, since your nipples will change in size over time. Usually, you'll add between 0 to 3 millimeters to your measurement to find the flange that's right for you. Sometimes, you may need to add an insert to create a more snug and comfortable fit. After finding your fit, you'll also want to get the hang of managing your pump's modes so that you know what level of suction is right for you and how often to toggle between stimulation, which triggers letdown, and expression, which pulls out milk. This can make all the difference in your milk output. If you've been nursing on demand up to this point, you've likely been making just the right amount of milk for your baby. That's the magic of supply and demand. Once you introduce a pump, you'll want to make sure that you continue to make the right amount, not too little, not too much. To avoid a dip in your supply, also known as undersupply, you'll want to pump every time that your baby has a bottle. The goal is to continue emptying your breasts as you have been. Once your baby starts sleeping longer stretches, you might also need to add a pump session to maintain your milk supply. And of course, sticking to a schedule will also help you stay in maintenance mode. To avoid oversupply, you'll want to make sure that you don't pump too often or for too long. Contrary to what you may think, you actually don't want to make too much milk. Oversupply can lead to plugged ducts, which feel like painful knots or lumps in your breast, as well as mastitis, which is marked by pain, swelling, and even flu-like symptoms like fever. Not to mention that making too much milk can lead to waste. Whether you're pumping at home or on the go, you'll want to have a plan for safely storing your milk. Stock up on food-grade, leak-proof storage bags, which can be labeled with the date and the number of ounces before going in the fridge or freezer. You can also pool your pumped milk throughout the day in a glass or plastic milk pitcher. If you won't have access to a fridge right away, consider investing in a portable milk cooler that will chill your milk until you get home. You can also put storage bags into an insulated pack filled with ice packs and keep your milk cold that way. Once you have the right tools, make sure to read up on the milk storage guidelines established by the CDC. Milk can be stored for up to 4 hours at room temperature, up to 4 days in the fridge, and up to 6 months in the freezer. If it's being stored in a cooler, it should remain at 59 degrees to prevent the spread of bacteria. When it's time to thaw your frozen breast milk, Always make sure to use your oldest breast milk first. Milk can be thawed in the fridge or under warm running water, but should never be microwaved, placed in boiling water, or left at room temperature. Deciding to combine pumping and breastfeeding can be freeing, but it can also be challenging. If you're struggling with pain, discomfort, or sudden shifts in your supply, don't wait to reach out to a lactation consultant for support. They can help you establish a routine that works for you, troubleshoot if you're seeing your supply dip, and even provide guidance on your specific pump's settings and sizing. Finally, remember that there are lots of reasons that a mom may decide to combine pumping and breastfeeding, and that no two babies or feeding journeys are the same. Comparing your supply or your pumping schedule to others will only create stress. For more tips on combining pumping and breastfeeding, plus expert-backed guidance on all things supply, make sure to like and subscribe to Willow. You can also shop pumps, accessories, milk storage essentials, and more at onewillow.com.